Good afternoon, everyone.
Yeah, good afternoon.
Good afternoon, sir. Good afternoon. So we are going to start in a minute.
Yeah.
So good afternoon, everyone. A warm welcome to all of you to today's webinar on sensitization on accreditation standards for medical transport organizations. I am Ankita Gill, Assistant General Manager at QAI, and it is my pleasure to open this session. I hope you all are doing well and are excited as I am for today's discussion. So, to start with, the importance of accreditation in the medical transport sector cannot be overstated, and it plays a pivotal role in ensuring high standards and quality in healthcare services. Today, we have an esteemed lineup of speakers from diverse backgrounds who will provide us with the valuable insights on the need of medical transport standards and how accreditation contributes to achieving excellence in the critical field. So before we dive into today's session, I would like to take a moment to express our gratitude and introduce our distinguished speakers who have graciously agreed to share their expertise with us today. We are honored to have such accomplished professionals and we are truly appreciate the time and effort in their being here. So please join me in welcoming Dr. Professor Tamarish Kaul, who is the Director of Emergency Medicine at Dr. D.Y. Patil Medical College Hospital and Research Center. He's also a chairman in our technical committee for MTO standards. Dr. G.V. Ramana Rao, who is a director at the Emergency Medicine Learning Center and Research, and also a member in technical committee for MTO standards. Also with us, the Dr. Daneshwar Shelke, Dr. Daneshwar Shelke, Chief Operations Officer at BVG Maharashtra and Jammu and Kashmir EMS, and he's again a member of TC for MTO standards. Also, Mr. Prabdeep Singh, who is a founder and CEO of Red Health, and also our member of TC standards. So this webinar promises to be an engaging and informative session, and we encourage you all to actively participate by sharing your question and answers during the question answer segment. So without further ado and taking consideration into the time period, so let's begin our first session. And I would like to invite Ms. Rehma Javed, who is our Deputy Manager at QAI, to give us an introduction to the Quality and Accreditation Institute. Over to you, Rehma.
Thank you so much, Ankita. A very good evening to everyone. So we are going to start with an introduction to QAI before we move ahead with our agenda. Once again, welcome everybody to this very first sensitization program on medical transport organizations accreditation program. Thank you so much everybody for joining us. And we would like to begin with our introduction to QAI today. This is our logo with the tagline Change, Adapt, Improve. QAI as Quality and Accreditation Institute. So we started our operations in August 2017. We are considered to be the fastest developing accreditation body in the world. Why we say that? Because the number of accreditation standards that we have developed in the past 7 years is number 17. That makes us fastest developing accreditation body. And this is our organization structure. QAI divided into 4 different verticals. There is Center for Education and Training. There is a Center for Accreditation of Health and Social Care, under which this medical transport organization is a part of. Then Center of International Accreditation, where all laboratory-related accreditation programs are put into. And then we have something different for accreditation of veterinary facilities, whose standards were developed and in partnership with the Ministry of Animal Husbandry. So what are our programs? First, we'll talk about Center for International Accreditation, which is chaired by Professor Vikram Kumar, former Director CSIR NPL. So we have accreditation program for ISO 15189 and accreditation of testing and calibration laboratory as per ISO IC 17025. Then we are also providing certification for medical laboratories. We have biobanking accreditation as per ISO 20387. This is QAI, the first accreditation body to have such accreditation program in India. Then we have for proficiency testing as per ISO IC 17043. Then we have for inspection bodies ISO IC 17020. And then we have accreditation of reference material producers as per ISO 17034. Talking about a little bit of numbers, CIA, our leading accreditation program, testing with 76 accredited laboratories already, followed by Medical Lab 13, Calibration Lab 4, and Biobank 3. And this is the trend for CIA. So in 2018, we had 2 accredited laboratories, and now in 2024, the graph has taken us to 106. Coming to Center for Accreditation of Health and Social Care, which is chaired by Professor MC Mishra, who is former Director AIMS, New Delhi. These are our programs under CHSE. So we are covering the entire care continuum. We are starting from clinic, taking to ambulatory care facility, hospital. We also have home healthcare accreditation program with us. Then we have transition and inpatient rehabilitation, telehealth, something different, hotel and homestays, then disease-specific dialysis centers, ART IVF, emergency department, green healthcare facility. We have a certification program for WHO patient safety-friendly hospital standards. Then we have primary and advanced stroke center. We have vision centers. Then we have QAI 101 plus and medical transport organization. And I would like to announce that the work under progress for these 2 accreditation standards, as mentioned, first one is bone marrow transplant and hair transplant clinic. So very soon they are going to be launched. So hope you all keep awaited for that. Again, the numbers under CHSE. This is the trend. We started from 1 in 2018, and now we are 115 in 2024 till date. This is just to brief you about our numbers in different accreditation programs. So our leader, ART IVF with 54 accredited organizations, home healthcare 7, dialysis center 8, we have WHO patient safety friendly hospital certification 1, ambulatory care 5, telehealth 2, emergency department 8, Transition Care Center 4, Stroke Center, including primary as well as advanced, 17, hospitals, 6, certification for hospitals that we have done for 1, clinic 1, and vision centers 1. Our international recognition, so we are the first accreditation body in India to achieve ISQA EE accreditation in less than 5 years of operation. So we got it in July 2022. And this is for recognition by the Ministry of Health, Central Government Health Scheme, CGHS empanelment of private hospitals, eye centers, dental center, and imaging centers. Now for CIA, we are full member and MRA signatory of APAC and ILAC MRA for testing, medical testing ISO 15189 and testing ISO IC 17025. So this is our accreditation mark, logo surrounded by gold seal, mark of sustained quality accredited. Our clients, this is for ART-IVF. We have Wadia Hospital, Indira IVF with 40 centers all over the country accredited by QAI, over 40. And recently we accredited Indira IVF Center in Nepal as well. Then we have Apollo Fertility, Oasis Fertility, Dr. Mehta's Hospital, IVF Center, ART Fertility, Nova IVF Fertility, Motherhood Hospital. So these all are our clients under ART IVF. Then moving on to home healthcare, all big players are accredited by us, HCH India, Guardian Angel, Max at Home, Portia Medical, Apollo Home Care, Antara Assisted Care, ProTribe, Kite Senior Care, Bangalore. Dialysis centers, Chandan Hospital, Lucknow, DCDC, Ambala, and then Apollo Hospitals, Dialysis Centers, 2 that has been accredited. Now, Continental Hospital, certified for WHO Patient Safety Friendly Hospital. Emergency departments of Dr. Mehta's Hospital, CMC Vellore, Apollo Hospital, DRDO, Hyderabad, Sikandrabad, and Jubilee Hills. Wockhardt Hospitals, Thane, Rajkot, Nagpur, Mumbai. Ambulatory care facility, ProSmile Dental, Kalyani Dental, TCL Dental, and Panacea Institute of Radiology available with us. Now, hospitals, Metro Hospital, Preeti Nursing Home, ACE Gastrocare Prayagraj, Apus Nova Meerut, Nayar Medicity Trivandrum, Sarvodaya Super Speciality Hospital Ghaziabad, St. Thomas Hospital Kottayam, Vinayak Hospital Delhi, Sarvodaya Hospital, again one more hospital in Ghaziabad, Life Medicity Hospital Jabalpur, Nauroji Wadia Hospital Mumbai, Shri Markande Sholapur Sahakari Rugnalaya Hospital, Health Shore Multi-Speciality Hospital Mohali. 2 telehealth facilities accredited, Al Zahra Hospital Dubai and Practo, Kickwell Technologies Private Limited, Bangalore. Transition care centers, HCH Suvitas, Hyderabad, Uchwas, Hyderabad, Ayurved, Bangalore, and Kites, again, Bangalore. Our clients under Stroke Center, Lalita Guntur, Max Hospital, Parpaganj, Delhi, Senthil Multi-Speciality Hospital, Erode, Dr. Vanshi Lingam, Thanjavur, Baby Memorial Hospital, Calicut, Dr. Ramesh Cardiac and Multi-Speciality Hospital, Guntur, Mazumdar Shaw, Bengaluru, Apollo BGS, Mysore, Metro Hospital, Calicut, Apollo Hospital, Ahmedabad, Zydus, Ahmedabad, First Neuro Brain and Spine Super Speciality, Bangalore, CIMS Hospital, Ahmedabad, Krishna Institute of Medical Sciences, Sikandrabad, KIMS Trivandrum, Calcutta Medical Research Institute, Kolkata, Wockhardt Hospital, Thane, KIMS Al Shifa, Kerala, NM Virani, Wockhardt Hospital, Rajkot, G. Kuppuswamy Naidu Memorial Hospital, Coimbatore, KMC, Tiruchirappalli, Sri Ramakrishna Hospital, Coimbatore, Wockhardt, Mumbai, CMC Ranipet, and then Paras Hospital, Gurgaon. For primary, we have all 4 Tirupur Medical Foundation, Lifeline Hospital Azamgarh, UMed Palakkar, Valluvanal Palakkar. So they are under Stroke Center, our one client under Clinic Accreditation Program. This is a Mongolian clinic, Tex Duren Hussein, so recently accredited by us. Vision centers that are being accredited under Maharashtra, Karad Vision Center, Koregaon, Satara under HV Desai Hospital, Bhesa, Ikoda, and Nandipet, Utnur under LVPI, Naxalbari, Bagdodra, and Malbazar, Siliguri Great Alliance Eye Hospital. Nandiuban Vision Center, Manakmaung Vision Center, Nanauta Vision Center, Sarsawa Vision Center, all in Uttar Pradesh for Dr. Shroff Charity Eye Hospital. Then we have Trilochan Netralaya, Odisha. Then all three are for Trilochan Netralaya Green Vision Center under in Odisha. Then for Sadguru Netra, Madhya Pradesh, we have accredited 3 vision centers. Then we have Arvind Eye Care System, Tamil Nadu, 4 different locations. QAI 7101 Plus, Chandan Hospital, Lucknow, and University Hospital, Mongolian National University of Medical Science, Mongolia. Let us know our geographical spread. We are already in Nepal, Qatar, Bahrain, UAE, Maldives, South Africa, Ghana, Bangladesh, Myanmar, and Mongolia. India, yes, we have covered, obviously. Now we are working for Gabon, Morocco, Congo, Oman, Kuwait, Uzbekistan, Kazakhstan, Georgia, and Canada. Thank you so much, everyone, for your patient listening. I hope you had a good time. Any questions, I'm ready to take up. Over to you, Ankita.
Thank you so much, Rehema. That was very informative, and I'm sure most of the people who have any query related to QI will definitely reach to you. So, not taking much time, we'll go with the program schedule. I would request Dr. Tamarish Kaur to please come on the screen and share his expertise of advice on the needs of the medical transport standards. Over to you, sir.
Thank you and good afternoon. I think it's a very important accreditation for not only our country, but also for the region. And that is why those of you who have participated in the inauguration of the MTO standard, this time the chief guest of the function, Dr. Saleh Faris, who is the current president of the International Federation of Emergency Medicine, has rightly remarked that this is just a beginning, not only for India, but also for the region. And I would like to start with that note and basically raise 3 important points in this aspect. The first and foremost is why pre-hospital care is important. The second is the pre-hospital care and the pre-hospital care providers in India and the expectation from them. And third, why the accreditation is needed and why it was much needed. And now we have finally got the accreditation standards. So first and foremost, if you look into the pre-hospital care as a science, you will find that much of the emergency and trauma care outcome is dependent on what we do at the scene, what we do during the transit, and how do we really kind of stabilize or package the patient and hand over to the emergency department crew. And this has been time and again proven that if there is a delay in time, which relates to the access and sensing of the EMS, if there is a delay in providing the appropriate care, which relates to the pre-hospital care as a core, and if there is a delay in recognizing certain signs and not able to treat properly in certain conditions, the outcome is poor, no matter where the patient is landed. The patient may be landed in the best hospital of the city, the best hospital of the country, in the hands of the best doctors and best surgeons, but still the outcome will be poor. And there are certain time-sensitive an outcome sensitive disease. And then the spectrum is increasing day by day, which we're realizing that the pre-hospital care is actually very important component of the emergency care. And time has come to actually relook into this and focus on what exactly we want to have in our country in terms of a very good, robust pre-hospital care. As the Honorable Prime Minister has given the vision of Vikshit Bharat by 2047, by which when India will celebrate its 100 years of independence, we will be really claim ourselves to a developed country. And that claim will be incomplete if we cannot deliver one of the best EMS system in the world. So we have limited amount of time to march towards that. And I truly believe that this emergency care standard and the work towards that, especially the stakeholders who will be working towards it, will be able to deliver that promise to our nation. Now, coming back to the pre-hospital care providers and the stakeholders, the history of pre-hospital care, if you look into any other country, is actually the mother of genesis of emergency care. If you look into the history of US, and if you turn to the year of 1966, you will realize that there was this landmark paper which was talking about the lack of pre-hospital care, lack of trauma care, and thereby the people who are dying on the roads of American streets. And this is in 1966. And in India, this continued for several decades. And finally, in and around the year 2000, 2003, 2005, we realized that we also need to have a good pre-hospital care in order to save many more lives. And therefore, we saw from one or two hospital system which came up with EMS to the to the birth of big emergency medical service providers like EMRI and then the other providers which came in and started to manage the statewide EMS. And that was truly the transformative moment of the EMS in India. And whatever EMS we are seeing today is because of those large players who are trying to deliver a large-scale EMS, where the motto of EMS, that right patient at the right time and the right care, is only possible because of these large players which have been working tremendously across states. And this is by far, when if we count the numbers, some of the world's largest EMS operations are actually happening in India and backed by technology. Then came what we are seeing recently are the companies or the institutions who are trying to look into the existing ambulance providers, ambulances who are affiliated to any organization or just serving in some areas, and trying to aggregate them under a technology platform. And that is the latest version of EMS which we're seeing. And certain organizations are looking to develop as kind of aggregator services, but to maintain the standard and the quality. And this is the latest form of EMS. Having said that, I would like to opine here that the EMS services has not got their dues till date. It is very unfortunate that the paramedics or the EMTs who are working very hard, the medical dispatchers, the fleet managers, have not been able to get their right recognition and the right dues in terms of the national education framework or whatever system we may call. There are paramedics council which are there in statewide, but having under them bringing a national framework is still due. And I hope that with the new National Allied Healthcare Council, they will not only be able to maintain the profession, but also recognize the individuals or the organizations who have been working from the beginning and carrying out this service. So this is another wish which we would like to see, along with the accreditation, that the people who are providing care, people who are riding in the ambulance, get their due recognition and respect, and get also the citizens' recognition on what they do. And this is very important for a nation to recognize them as equivalent to our soldiers who protect our borders. We must recognize our EMTs as the soldiers on the streets And they are the ones who are saving lives and providing the best outcomes, for which we as doctors sitting in the hospitals have been able to provide good emergency care. So that is still due, and I hope that through this pathway and recognition, we will get it. And finally, I would like to talk about the accreditation which we are working for and which we have just now released. See, accreditation is always voluntary. This is not a mandatory requirement. Nobody is pushing any organization to get the accreditation. The accreditation is voluntary. So therefore, every organization must take it as an onus or responsibility of their own and try to see what best they can do in the pathway of accreditation. And accreditation process or the guidelines, following the guideline, doesn't mean that they have to put the application immediately because some other organization is doing it. Just don't get into this kind of competition or kind of a feeling that we have to apply as soon as possible. Get hold of the documents and see and do a self-assessment and see what is the gap and try to get into the journey. Getting into the journey is more important than reaching the destination. And as I always say, quality is a journey, it is not a destination. So even if some organization is getting the accreditation, they have to maintain and sustain that accreditation and improve upon their own standards. And that's the ethos of accreditations. And that I believe will be strongly carried out by the medical transport organizations of this country. And once again, I would like to remind all of us that by 2047, when we celebrate our 100th year of independence, we must be able to deliver world best emergency medical services for all our citizens. Thank you.
Thank you so much, sir, for enlightening us with the facts. And as you have already mentioned, lack of pre-hospital care in several decades. And now we have come up with the MTO standards designed by our technical committee. So I'm definitely 100% sure that most of the hospitals, as you have said, that this is a journey and we have to go with the quality things. We'll apply all the standards in their ambulance services and go for excellence in accreditation. So going forward, let's come up to the second speaker of the program. So I would like to invite Dr. G.V. Ramana Rao, who will be talking about how accreditation contribute to achieve excellence in quality services. Over to you, sir.
So thank you so much, Team QAA. And at the outset, I want to refer to the Dions who have been involved and got the blessings. Dr. Giridhar Gnani, who has brought quality to India in terms of the healthcare. And I also want to refer to Professor Mishra, the former director of AIMS, who is directly involved in our project. And we got a good opportunity to meet up with people who have been considering the pre-hospital or EMS or ambulance services or the medical transport organization as a very good means of saving lives and creating an impact and improving the quality of life of the distressed individuals. Having said that, I just wanted to bring the concept of thinking, doing, and communication. Over the last few months, the technical committee members have did a lot of brainstorming, and we were able to document considering some of the rich experiences from QAA. And we have created a very vibrant, dynamic document. And it's a time that this concept is disseminated all 360 degrees, and all the stakeholders should peruse that. And I want to add to what Tamrish was mentioning, that they should take this as a very important platform and see when is an appropriate time, whether it's a small, medium, or a large organization, to take forward this accreditation process. So, and continue thereafter. Having said that, when we talk about accreditation, that will also reflect on the standards, which are very, very important for a medical transport organization. And all standards would provide some assured care, or I'm using the word quality. And when we talk about a complex EMS system, then the processes and the metrics would enable us to really understand each of the segments of this entire pre-hospital care, and therefore the metrics-driven approach would also be very helpful, and it is significantly reflected in the standards what have been identified in this document of the MTO standards organized by the QIA. And I'm very happy that a framework is used, as in the case of other accreditation standards, and that would help all of us to look into these things in a very objective manner. Moving from subjectivity to objectivity, very important that it's not the facility-based emergency care or any other discipline, but EMS can also be very proudly be mentioning that this framework will bring standards into each of the nuances. There were very strong references not only to road ambulances, but air ambulances, water ambulances, and rail ambulances, and hence I would use that these standards are all encompassing or universal in nature. During the discussions in this accreditation, we have taken into consideration, because health is a state subject. There are some national level and then state level things, and we have given due recognition to the statute or the local laws we need to follow, and the medical legal dimensions also. So this accreditation document would also very adequately provide the adherence to the regulatory or the legal framework also. This accreditation of the medical transport organizations, I just wanted to add that it will be a very dynamic thing. I'm sure periodically it will be reviewed and then updates would also come. I want to take one more leaf from what Tamresh Kohli was mentioning, that by 2040, we'll not only have paramedics, but AI-based paramedics in our country. And then it's very important that this should be a very agile process. Like other areas of emergency care, do no harm remain should be a basic premise, and the existing evidences that patient safety concerns are being expressed, and that can be overcome by experiential learning in the educational processes and during the implementation, and necessary medical directions would also enable this patient safety as a very core area of the outcome of this accreditation process. India is a part of the lower and middle income countries. I'm sure that there'll be some financial challenges, and hence many of the people who are all involved with this, and I'm sure down the line we would also hear from all quadrants that the accreditation process what has been envisaged is very cost effective. So with less, it should give more for more people is the one of the things what we all kept as a part of the team here, and I want to articulate that very clearly. And we wanted to be very sure that this accreditation process would be a very good springboard for continuous improvement. I'm using the word enhancement of all the facets of the entire the transport organization, or the medical transport organization, or the pre-hospital care, or the ambulance organizations. Having said that, I all try to put all of these thoughts into one slide. I would request Ankita to just applicate if it's possible in my own way, so that we're all able to take out some time today and then see. The message is very, very clear. We are all ambulance people, and for each of these alphabets, A represents the accreditation, what has been done so far, reflecting the quality and standardization. I was referring to the metrics-driven approach or measurability, so that we will have a continuous improvement. And I was referring to the standard framework. She has just mentioned that the 17 has been already done. And then that framework is very, very critical. That speaks about the conceptual strength also. I was referring to the road, rail, air, and the water things, which also is a U or the universal appeal of that. The medico legal statute related things, state and the central related laws are very respectable. We need to adhere to that, because in emergency care, all of these things become very pivotal. Dynamic nature is reflected in the alphabet A, and continuing to be conscious about the patient safety is a core, in addition to the other frills which I referred in the alphabet N. The cost should be affordable by various levels of organizations, large and medium level organization. I'm sure that many neighborhood countries and the region would also be benefited by being economical. And finally, our journey towards excellence should start with this framework, by not only getting sensitized today, but enabling them to think through and then plunge into some action, so that would make a very humble beginning and our journey would be appropriate. And finally, the emergency patient should get the benefit out of this. These are a few thoughts I thought I would share on this very beginning of this webinar, what has been hosted. Thank you so much. And I'm very happy to see other my colleagues who have been involved in this business of saving lives for several years. Thank you so much. Over to you.
Thank you so much, Dr. Rao. That was a wonderful insight. You have already mentioned about the AI, and definitely AI is the future of the healthcare. And as we have developed the standards, we have taken care IMS, which is Information Management and System, that also takes care of about HMIS and other things which will be enabled in future with the AI. Definitely going forward with the program schedule, I would like to invite Dr. Shelke, who will be talking about impact of the standards on improving ambulance services. Over to you, sir.
Yeah, good evening, all of you. After Dr. Tamorish and Dr. Ramna Rao, I think it is a right context that it is set for the accreditation standards discussion. So primarily, I thank QAI and Dr. Rana for taking such an initiative. And I think Dr. Ramna Rao mentioned about the TDC concept. A lot of thinking has gone behind bringing out these standards, much needed standards, I will say, for the country. So as far as the impact of these standards on the emergency medical services in the country is concerned, Dr. Tamorish mentioned about the start of EMS in US in 1966. In terms of India, we will have to understand probably 3 or 4 important years where, prior to 2006, there were emergency medical services across the country operated in the very, silos way. In all the cities, there were best practices available in Delhi, Mumbai, Pune, Hyderabad, and all the other cities also. With the formation of National Rural Health Mission and establishment of Emergency Management and Research Institute, country got the state level emergency medical service, and that is where the need of the society in terms of emergency medical care is met at the larger level. And I think we are a very proud country now that majority population of the country has now access to emergency medical service. So that is almost after 2009, the wide access to the emergency medical services has been created across the country. And probably 2024 is the key year now again, where we are talking about the quality accreditation standards for the emergency medical services. Establishing something, making sure it delivers what is required to be delivered, and now ensuring that it is structured to the requirement of the community. Now this phase of expansion and phase of need, probably I think this forms the 2024 as the key year in the emergency medical services history. Now, what it does for the organization is that until now, most of the larger organizations were working around the control room, the ambulance designs, and the the key component of training and HR management. Now, when we are looking at the standards, I am sure that not only the smaller organizations which do not have these components, but the larger organizations also will able to benefit by having thought about the 360-degree perspective of these services, which otherwise probably in the normal course of working we tend to have a lower importance to those things, like ensuring the efficiency by reducing some times and improving qualities. So those kind of things, I'm sure that with the introduction of quality standards or accreditation of the organization, they will able to add it as one of the thing in the organization. Now, the another important thing is that it also, when we do the day-to-day jobs, uh, we tend to fulfill the needs of the patients as it comes. So we do not think holistically 360 degrees need of the services. Probably the standards will add a lot of value thinking 360 degree about the services. Say, for example, when it comes to the governance, when it comes to the infection control inside the ambulances, when it comes to the hygiene maintenance, all of these things probably which were certainly thought, but the importance was which was given lesser. Now probably the accreditation agency will definitely look into it and will have added value to the organization in terms of establishing processes and quality standards related to it. So this holds the most important part to the organization. Also, when it comes to the HR, because emergency medical services is all about having quality HR, quality training, and there are various aspects, various professionals, those who contribute to the quality emergency medical service delivery. So and there are some special aspects to the EMS, including mass gathering management, mass casualty management, and lot of scenarios in the country where the EMS has to be structured to the need of the population. So such things, I'm sure that with quality standards, organization will able to adapt itself to the needs of the community. And we will also able to do the risk profiling, which was otherwise, it was not a priority for the organization. Now, this thought of getting accredited will add a lot of value in terms of profiling the risk from the perspective of HR, from the perspective of patient, from the perspective of government, lot of other things which will add value to the needs of the emergency medical services. Now, as I mentioned, that earlier we were looking at more of the three important aspects like control room, the ambulance, and the HR and training. Now we will able to also give more importance to the quality of care provided to the patients. And this, as we move towards the certainly the broader vision of developed country, I think this aspect will add a lot of value delivering quality patients, probably delivering a patient to the hospital in a much better shape and much better vitals or much better medical condition. So this will help a lot to the EMS agency from the perspective of adapting the quality standards. Now the lastly, when it comes to the emergency medical service, the funder of the service is the most important stakeholder. And in this case, while we are delivering the emergency medical service to the entire country, the government becomes the most important stakeholder. And if we can able to have the organizations accredited by the third party, I am sure that government will have a lot of faith in the organizations which are accredited by the third parties, because ultimately, what value we deliver to the governments, that makes a lot of difference to the community of the particular state or the country. The second important part and ultimate beneficiary of this is the citizen of this country, because the patient who will receive the care, and he understanding that the kind of care that he is getting is of high quality and with the required processes, I am sure that any accrediting organization will able to prove itself for the purpose it is meant for. The third important part is, as Tamurish mentioned, if we can deliver better patient to the hospital, I am sure the chances of survival of the patient are significantly higher. And there are many time sensitive illnesses like chest pain or the stroke or the trauma patients. I am sure that we will able to deliver better patients to the hospitals by having set standards in the services. And the third and most important is the agency itself, because by structuring itself uh, to the needs of the service, I am sure that even the smaller players having 5 or 10 ambulances will definitely benefit, because they do not have access to knowledge and access to technology. Now, with these standards, even the smaller players will have access to these standards and the way they need to structure their service. So the patient care will be improved through the smaller players also. And I think overall, this has come at the right stage where the entire country has access to emergency medical service. And I'm sure that this will be of immense benefit. And I'm sure that we are moving towards the developed nation. As part of emergency medical services is concerned, I think Dr. Ramana Rao has also mentioned a wise concept of AI-based paramedic. And I'm sure that, the country like us, which is technologically advanced and driven, we will able to adopt it quite fast. And I'm sure that we'll also come up with the standards for AI-based paramedics in future. So thank you very much. Thank you, QAI, for organizing this summit. Thank you.
Thank you so much, Dr. Sherke, sir, for taking us to the journey of EMS, emergency medical services, and highlighting that the standards, MTO standards, are the need for the hour. So going forward with our program schedule, we will be taking now the overview of the accreditation standards. So I would like to share my screen. I hope everyone can see my screen. So going forward with the accreditation standards, we are here for that MTO standards, and what is the accreditation standards talking about for MTO? So going with this. So accreditation standards, it is optimal and achievable. So this suggests that the standards set for accreditation are both high quality, optimal and realistic to attain achievable by the organization seeking accreditations. Also, it encourages continual improvement. Accreditation is designed to motivate organizations to continuously enhance their services and processes rather than merely meeting the minimum standards. Periodic evaluation, of course, accreditation is not a one-time achievement but requires periodic reassessment, typically every 2 to 3 years. So this evaluation is carried out by peer reviewers who are professionals from similar fields, ensuring that the organization maintains the standard over time. And of course, as Sir has also mentioned, it's a voluntary process. Unlike some regulatory requirements, accreditation is generally a voluntary process. Organization chooses to undergo accreditation to demonstrate their commitment to quality and excellence. So in this standard, we have a framework which talks about the 10 chapters, 77 standards, and 397 criteria. Before going and moving into the standards, I would like to talk about a simple accreditation process, the QAI accreditation process. It tells you about what you have to do to get the MTO accreditation for your organization. right? So first of all is the self-assessment. So there will be a self-assessment toolkit. What you can do, you can ask the UI Secretariat for the self-assessment toolkit. And this toolkit, you will be assessing your own organization on the basis of some criteria, which are already mentioned and framed. So with the application self-assessment toolkits, you will be sending the documents with that. And we will be reviewing and registering your organization on the basis of the application. And if some other documents are required, we'll be asking for that. We will be doing the document review. After that, there will be a pre-assessment, which is optional. That could be planned for on-site, remote, and hybrid. So if you are not going for pre-assessment, your hospital is almost very much ready. Your ambulance services are almost ready. So your organization is ready. So we can go for the on-site, which is a final assessment, right? For remote hybrid assessment. And then when you will be done with that, the assessors will come and provide you a report, and we will be asking you the non-compliances. We will be asking you the corrective action for that. When you will be submitting the corrective action, it will be reviewed by the accreditation committee. The accreditation committee may ask that some other requirements or some other corrective actions are required. Right? If it is done, everything is clear, then we will issue the accreditation certificate. The accreditation certificate is validity for 3 years. And after the 3 years in between, it will be a surveillance assessment from 15 to 18 months. And renewal of application, so hospital will apply, the MTOs will apply the 6 months before. Right? So this is the accreditation process, which is very general, and it is a very traditional method, and we are using it in QAI. So going forward with the framework, which has been decided by the technical committee. So we have 10 different chapters. The names are governance and leadership, human resource management, facility and risk management, information management system, continual quality improvement, patient assessment and care, patient rights and education, medical management and safety, communication and transport, hygiene and infection control. So we do have a standards of these chapters. There are different standards, and under those standards, there are criteria. So what is a standard and a criteria basically? So standard is a statement which defines the structure and the process that may be substantially in place in an organization to enhance the quality of care. Criteria is a kind of measurable component for that standard, and acceptable compliances with criteria determines the overall compliance with a standard. So the first chapter that is very important in governance and leadership. So each MTO requires a governance structure that is ultimately responsible for its quality and safety of services. This responsibility is derived from its legal identity and operational authority for all activity undertaken by the MTO within the ambit of applicable laws and regulations. Each MTO, regardless of its complexity, also has a formal structure. So leaders should ensure that there is a system exists that promotes safety, quality, provision of services, and that meets the need of patients, availability of adequate resources, which could be your human, financial, physical, and monitoring and evaluation of activities and process for improvements. So these are the basic intent of the chapter for GA, governance and leadership. Going forward with the human resource management, HRM, which sir has also talked about, Dr. Shelke has talked about, that it is a very important and integral part for the chapter, for the standards, which talks about that human resource include all the people that work in, for, or within the MTO, and they are integral to ensuring the delivery of quality, patient-centered, and safe care. The MTO must be able to assure the public and patients that it can meet their needs and deliver quality and safe care through a team of dedicated and qualified staff. The support includes in the management team provides a safe physical environment for staff to work in, which is free from harassments or accidents. So there are a lot of roles of the human resource which helps the organization to be a part of this standard. Third is the facility and risk management, FRM. So the MTO will prevent people from receiving unsafe care and treatment and prevent avoidable harm or risk of harm. The risk assessment, which the sir talking about, safe, high quality care and support is intricately linked to how resources are used, including how they are planned, managed, and delivered. MTO must assess the risk to people's health and safety. So it is talking about the risk and analysis for health and safety during any care of treatment. Make sure the staff have the skills, experience, and competence to keep patients safe. Premises, ambulance, and equipment must be safe and available in sufficient quantities. Good clinical practices are followed in all its operation. MTO must prevent the spread of infection. Going forward with the fourth chapter is information management and system. So information management system, yes, an effective information management system should be there based on the information needs of the MTO. The system should be able to capture, transmit, store, analyze, utilize, and retrieve information as and when required for improving clinical outcomes, as well as individual and overall performance of the MTO. Information can be in any form. It could be paper, it could be electronic, it could be any kind of media or a mix of both. Sound document control system ensures that the right document is available at the right place in right time with right people. So confidentiality also comes here. Continuous quality improvement, which is a CQI. The MTO must have an effective quality assurance and auditing system. These must assess, monitor, drive improvement in the services provided. So this is your database, which is going to provide an auditing system and help you processes most. Also assess, monitor, mitigate any risk relating to the health, safety, and welfare of people using the services. The facility must continually evaluate and seek to improve their governance and auditing practice. So there could be in changing of the auditing practices as per the indicators you which will be taking in your MTOs. Sixth chapter is patient assessment and care, which is PAC. So it talks about patients are made aware of the services being offered through different modes. Processes are defined for various activities, which could include your registration, administration, admission, referral, and discharge. Patients, once taken into MTO, are assessed and reassessed as per the policy for their clinical needs and treatment. The chapter 7, which talks about the patient rights and education, PRE. The patient is in the center of the care being provided in MTO. It is therefore important that patient rights are documented and known to the patient, which is we are talking about patient rights and responsibilities, which should be displayed as a part of the standard. It is also important to be providing education to patient related to their care and responsibilities. Better satisfaction or outcome is achieved when patients are adequately informed about their care. Their rights are respected. They are involved in the decision-making processes. The MTO is responsible for providing processes that support patients and families' rights during transport and care. Medication management safety, which is the chapter 8, MMS. The purpose of medication management is to provide a framework for safe and effective medication management system. Safe and effective medication management includes the process for procurement, storage, prescribing, transcribing, preparing, dispensing, and administration. All processes of medication management of the MTO comply with applicable rules and regulation. The 9th chapter, which is a very important part, and communication and transport for this MTO standard specifically, which talks about emergency medical services. EMS management is a specialized field where emergency healthcare needs are addressed through well-defined processes in emergency response center. Operations and training by EMS professionals. Important aspect of EMS includes early detection of any emergency, immediate response, reporting, on-scene care, en route care, and transfer to appropriate definitive healthcare facility. The purpose of Emergency Response Command Control Center is to provide a framework for safe and effective communication platform between patients and responders. Safe and effective ERCCC includes the process for call handling, triaging, dispatching, closure, and analyzing and reporting. All processes of ERCCC comply with applicable rules and regulations. These standards are also important for the organization to maximize its own effectiveness and to be responsible to the public. The presence of well-defined clinical standards is an essential foundation to the provision of out-of-hospital healthcare facility quality. The MTO must be able to assure the patients and public that it can meet their needs and deliver high quality and safe care through a team of dedicated and qualified staff. Coming towards the end of our MTO standards chapter 10, which is talking about hygiene and infection control. The changing technology and disease profile continue to present new challenges for infection prevention and control within the MTO. Patients are at risk of developing healthcare-associated infections. Healthcare-associated infections are among the most common complications affecting patients. The MTO establishes the processes to ensure a good hygiene and infection prevention and control practices during the transport of patients. So these are the chapters which are included in the MTO standards. These are definitely few of the intent, but definitely there are more criteria which will describe you when you will get the standards. So I would like to take a key takeaways that could help you to remember that what we have talked about in the PPT. It is about GAL, governance and leadership, establish governance structure for quality and safety, ensure resource availability and continuous improvement. The human resource management talks about focuses on qualified and dedicated staff, provided a safe, supportive work environment. Facility and risk management talks about maintains safe facility and equipment, emphasizes risk assessment and clinical best practices. IMS talk about effective data management for better outcomes and robust document control and information accessibility. TQI talks about quality assurance and auditing for service enhancement, ongoing evaluation and risk mitigation. PAC, Patient Assessment and Care, talks about standardized processes for patient care activities, regular assessment and reassessment of patient needs. PRE talks about patients' right and education, which upholds patients' rights and provides care education, involves patient and decision-making processes. MMS, Safe and Effective Medication Management, compliance with regulations and non-medication processes. Communication and transport, standards for emergency response and communication, safe and effective coordination between patients and responders. Hygiene and infection control, it talks about hygiene and prevents infection during transport and adapts to evolving infection control challenges. So this is all the key takeaways which are talking about that how you can go for the accreditations for your ambulance services and medical transport organizations. Going further, we have developed the standards. Now we have some kind of action plan which was required by the participants as I have received some queries. So I will be talking about what we are going to do further to do the implementation from the QA side. The first thing is that of course, we have a QA LinkedIn page and we do have a website. I would request all of you to please follow the page so that you can get more information about the registrations of different programs, MTOs, the DIVE and other programs which we will be doing for the MTO standards. So this is one of the forum where you can always see that what is the new thing which is QA introducing and you can always join and do the attend those programs. So what we are going to do, the MTOs and ambulance services, that what you can do first of all, that you can request the accreditation standards because it was an intent of the chapter and I have told you that we have this much of standards in chapters. But what you can do, you can ask us the accreditation standards. We will provide you the whole package with the information brochure, the guidelines and everything which we have ready with us. And we'll provide you the fee structure and everything, how you can go about it. Second thing is our DIVE program. So we are going to come with the DIVE program, which is Documentation, Implementation, Verification, and Elevation on Medical Transport Organization Accreditation Standards. We are planning to have this DIVE program in the second week of October. What is this program talks about? It tells about what kind of documentation are required when you will be doing the self-assessment toolkit, and you will be finding out that these are the kind of partial compliances from our side, and more documentation is required. So first, you need to understand what you have to do and what the standard intent or criteria intent is telling you about, right? So for that purpose, the documentation, the right documentation, it will be of course done by the experts. So they will tell you that what is the standard asking you about, what is the criteria that is talking about that documentation, that it will be provided in documentation. Then you will be implementing those things and the verification elevation towards the accreditation process. Right, so we will be conducting it maybe a 3-day program. So we have finalized the dates and we will be doing in Zoom. So there would be some kind of restructure for that. Definitely, we will be posting these flyers in LinkedIn. So I would request you to please follow those programs so you can see what we are coming with. And this program will help you to understand each chapter, each standard, each criteria, so you can do the documentation and the required evidences to go for the accreditation. The second thing after the DIVE we will be doing is that, of course, we need assessors also who will be assessing your organization, right? So we will be doing an assessor training course for MTO program. So that is also again planned in the last week of October 24 to 27. That program, we will be asking you people who are experts in the MTOs and emergency medical services to come forward and become an assessor of these courses. And then you will be also getting a lot of knowledge in that, and you will be sharing those knowledges with the other ambulance services, the small ambulance services and big one. Right, so we will be doing the assessor training course. So again, this flyer will be also posted on LinkedIn. You can follow us and can get the details. Also, we will be sharing us, whosoever will be asking. So I'll be sharing my contact details. then you can always come up to me. And this is also written here that ankita@qi.org.in. So you can always reach out to me over the email, right? And over the phone. We have all the details on all the websites, social media and everywhere. So you can please come to us and ask for the help. We are always there to help you to get your ambulance and MTOs accreditation services. So I would like to just tell you one more slide. I have added that for becoming an assessor, there are some kind of requirements which you have to do. And there, of course, there will be some kind of documentation required to this. So we will be asking you those things. So this is a kind of assessor qualifications which are required to become an assessor. We will be posting this to you. And if you specifically want separately like this, so you can ask me again on my email ID, and you can also call. We are just one click away. So going towards the end of the program, I have already shared the standards, intent, and accreditation standards, what they're talking about. I'm opening the forum for the question and answer. I would request everyone that if you have any questions and queries, please raise your hand so that I can take your name, and our experts who are present here and also the QAI team will take your questions and we can answer your questions. Thank you. To understand most of the things, I would request if anyone have any query related to anything, you can always come up with a question so that we can understand that maybe we don't have the answers right now, but we will frame that thing for you so that we can come up with a good solutions to you. Okay, I think our speakers and we are very clear about this, and you all are hoping to mail us for that purpose. That will be also okay with us. So I would like to, first of all, I would like to thank everyone who has participated in this event, and I'm sure that you must have got a lot of insights about the QI programs and also the MTO standards, which we are doing, and you will be definitely applying for these, as sir has again said, which I liked a lot, that quality is a journey. So to start implementing those things and sure your organization ambulance services will definitely get accreditation. So thank you, Dr. Tamoresh, Dr. Rao, and Dr. Shelke for this such enlightening us with your experiences. So I'm very honored to hear from all of you. You have shown us the pathway towards the accreditation. Now, I would like all of you to please come on screen for 1 minute because we have to take a small picture, and that we can always remember these faces. Just for 1 second. And Sakshi, our QI member, will be taking and clicking the picture. I think somebody. I would request everyone to please come for 1 second so that we can have a good picture. Sakshi, you can take all the screens,
Yes.
please.
Yeah. Sure, sir. Thank you so much, everyone.
Thank
Okay.
you.
Thank you
Thank
so
you.
much, everyone. We are waiting for your queries. I would love to have to answer your all queries. Please email me to ankita@qi.org. And also you can check on our LinkedIn profile all the flyers related to DIVE and other SSA programs. Thank you so much, everyone, for this wonderful participation.
Thank you.
Thank you so much.
Bye.
Bye-bye. Take care.
Thank you. Thank you.
Thank you so much.